It's really my pleasure to introduce Maiyia Kasouaher, and a planner with the Minnesota Department of Health. She is going to be in conversation with Jen Rooney.
Hi, Maiyia. I'm so glad you're here. So thank you for being here. I think you and I are being tasked with kind of putting it all together from what's happened today. Okay, so we have seen all kinds of great examples of things that are happening around the state. We've also learned from Sarah Lenz-Locke how important risk reduction is. And at the very beginning of this day, I asked everybody to think about not only themselves coming at this as individuals, but also coming at it from a community view. And I think that's what you and I are going to try to do, is to pin it down a little bit and talk about how we can implement those risk reduction plans on a community level. So what do we mean when we talk? I mean, Sarah talked about it some, but what are we talking about when we're talking about risk reduction? And is that eliminating the possibility of dementia or delaying? Give us your definition that you're working with.
Yeah, so first, before I go into that, I just want to say thank you for having me on here. It is a pleasure to be here. And so to answer that first part, right, what we mean by risk reduction, it can mean preventing people from developing dementia or delaying the start of dementia. And for someone who's living with dementia, risk reduction can also help slow down the progression of that. And so we do this by working to reduce risk factors, right, which are biological, psychological, cultural, social, and these are the characteristics that impact how healthy we age. And there are some types of risk factors that are what we call modifiable risk factors. So the modifiable risk factors are the things that we can do as individuals and communities to improve our overall health, to reduce our chances of getting dementia. And I do want to provide a little bit of an idea of how much we can do, and that there's an article in the Lancet that reviewed hundreds of dementia studies, and it suggested that 40% of all Alzheimer's disease and related dementias can be prevented or delayed.
That's pretty significant, right? That makes us want to stop and change some behaviors, or to find out what we can do, and again, how to make it work in our community. And I know Sarah touched on some of those things. Can you talk to me about some of those modifiable risk factors that we could and should be focusing on here?
Yeah, so what we know is that the research shows that there are certain things, right? So physical activity and maintaining a healthy weight, checking your blood pressure regularly to make sure it's in a good range, preventing or managing a diabetes if you already have it. And then there's things like hearing. So if you have difficulty hearing, using hearing aids can be really helpful to keep your brain sharp. And then there's social connectedness and engagements, right? Having someone who you can trust to talk to regularly. So these are some of the risk factors that have the greatest impact on dementia health outcomes. And then there are other risk factors as well. And then some that are less known but are of interest, including dental and oral health.
Okay, so I, of course, am intrigued by that. I want to, if it's okay with you, I kind of want to break it down and go through this list. And we sometimes talk those, I'm a social worker, and I know when we have tried sometimes to have these conversations, I hear a lot of feedback about it's the don't list. Don't do that. Don't do that. Cut this out. So I think maybe one of the things that you and I are trying to help get started today is to reframe that into pushing positive brain health, right? And so looking at it as promoting brain health might be the language that we're going to use. So with that, what do we know about physical activity and eating healthy?
Yeah, so for physical activity, we want to emphasize activities that increase the heart rate, really getting the blood flowing and pumping through the body. The U.S. Department of Health and Human Services recommends 30 minutes of physical activity every day. And just thinking about that part, right? We don't want it to feel daunting for community members. Some examples of what that could look like would be playing with your children or grandchildren, right? Chasing these kids with a lot of energy around really will get your body moving. Things like cleaning and yard work, raking leaves, mowing the lawn, walking, dancing, swimming, even going up and down the stairs would really get that heart rate up. For those with limited mobility, there are things like chair and arm workouts and movements. So there's that part of it. And then for healthy eating, eating meals with fruits and vegetables, lean proteins and whole grains. These are the foods that give your body the nutrients it needs to have the energy to maintain your health.
So as you and I were talking, this is really good, like for the individual, right?
Mm-hmm.
Now, if we all put on our community hats, how are we going to help our communities do it? How are we going to help them eat healthy? How are we going to help them with the exercise portion?
Yeah, so with the community portion of it, right? And I just kind of listed some examples of things that you can do. But with the healthy eating, right? Their communities really can make food, healthy food affordable and accessible, making sure that food banks and senior centers and hospitals have healthy food choices, ensure that people who live in rural areas have access to fresh food, fresh produce at the stores near them. And then if you think about, different ways of how you can combine these things together, there's gardening, right? So if you have like a backyard or access to a community plot, you can garden and have, healthy produce and include some of the physical activity in that. There are farmers markets that have locally grown, culturally specific options. It's good for the economy, right? You're supporting the local farmers. You're up and about walking, interacting, socializing in those spaces as well.
I know, I think I told you when we were visiting last that during the lockdown, or when we weren't able to come into work last year, I was going over to Bloomington, Minnesota, and they were having in the evenings an outdoors farmers market so people could be socially distanced. And then as a community, they were having concerts and encouraging people to dance. And I know that they were doing like lawn games for kids. I was really impressed, and I don't think Bloomington's the only one. Here in the metro, I think we see a lot of that, like since people respond a lot to like farmers markets, incorporating activities and community resources available there as well. And then as a woman who grew up in rural Minnesota, I know that they aren't always as formally organized, but I see people doing those types of activities all the time and helping their neighbors with the harvesting of gardens, and also just sharing the fresh food all over the place. I have not left the farm visiting my parents once this year where mom hasn't filled the trunk up and said share with everyone. So I think those are just really good practical ways for us to be community building. Let's talk a little about blood pressure and how we can keep that in check and what it has to do with dementia.
Yeah, so for blood pressure, we know that high blood pressure stresses the arteries, which can cause them to become harder, less flexible, and narrower, right? And having narrow arteries can prevent the brain from getting the oxygen and nutrients it needs. And so when this happens, the brain then may start to work more poorly. And so with this, there's a lot of research around this as well. And researchers estimate that a person's risk for dementia is about 50% greater if they have high blood pressure in midlife. And so to give you an idea of how common hypertension or high blood pressure is, about 1.1 million adults in Minnesota are aware that they have hypertension, but hundreds of thousands more are unaware of the high blood pressure. And usually this occurs in younger and middle-aged adults who are unaware of their high blood pressure. And so if they don't know about it, right, then they won't be able to manage it, which then can lead to many more years of damage in their arteries. So when you think about risk reduction, this is, an important point is to remember to get your blood pressure checked, even as a young adult.
When I'm thinking, again, from a community lens, how do we help people on a community level about that blood pressure? Back to those farmers markets, that would be a place, right, to have like a blood pressure check station set up. Where else in the community do you recommend as a good resource or a place where people can help promote blood pressure control?
Yeah, making it easy for people to check their blood pressure is really important, right? So, there are places that, places of worship, right, at the church. You can have a blood pressure station at school events and conferences, at public fairs and events, even at pharmacies. I know that some pharmacies have blood pressure check stations as well, at community centers and some businesses and libraries as well.
That is great. Now, one of the other diseases that we hear in conjunction with dementia a lot is diabetes. Tell me about why it's so important to control diabetes and what we should be paying attention to.
Yeah, so for diabetes, we know that blood sugar level affects your brain, right? That's why it's important to keep it under control. And high blood sugar level can damage the vessels that carry blood to the brain. And so when the brain doesn't get enough blood and oxygen, then the brain cells start to die, and that causes problems with memory and thinking. And in Minnesota, about 390,000 adults live with diabetes. And
that's a lot of people.
That is a lot. And, for individuals who are living with diabetes, they're 50% more likely to experience dementia as well.
Okay, so again, trying to think about what we can do, right? How do we, first off, I know that there is a big push right now that here at Trellis we're part of through our Juniper work and other entities around the state in diabetes prevention, right? We're working on an umbrella hub for a diabetes prevention program. So I think those are formal classes that can be offered in communities around the state. But what else? I know you had talked about different types of classes. Cooking, what were some of the other suggestions?
Yeah, so there are living well classes, right? And as you mentioned, cooking classes. There are other things that community organizations can do when they host an event, right? Serve healthy snacks and beverages, reduce or eliminate sugary drinks, have free, safe drinking water. And then, for when we are talking about what communities do, we're also talking about different levels of communities as well, right? So from the individual, family, caregivers, community organizations, local public health, right? And, one of the ways that these organizations can do is to support the programs, like you mentioned, the diabetes prevention program, right? So supporting this type of program that has been studied and tested to show that it works.
Yes, and the other thing I think community organizations can do, I had this conversation with you the other day. So this morning, when I went to bring in treats for all the staff who've been helping us put this together, it was yogurt and granola and more healthy snacks, because I think that's, again, something we can do community-wide that everybody can do at the big level, or even at a small thank you for level within your organization.
Yes.
So I am going to move on to the hearing loss question, because I find this interesting. I think we all, it makes sense to me, just practically speaking, about the food and the exercise, about blood pressure being controlled, diabetes under control. What does hearing have to do with the risk of dementia?
Yeah, so hearing has been strongly associated with cognitive decline and a higher risk, right? And so when someone has hearing loss, it can make the brain work harder to try to understand the words that they have missed. Hearing loss can also cause an aging brain to shrink more quickly. And then people who have hearing loss are less likely to socially engage. That social engagement means that, there's potentially less stimulation for the brain.
Sarah Lynn Zlock also mentioned like that social engagement piece. Those are the risk factors that I find most interesting, because I think just off the top of our head, we don't realize that maybe being in contact with others is so important, and being involved. And I can see the connection between that and hearing, but I also think we've identified throughout the day the number of older adults is increasing, right? And then when you look at the isolation that kind of a lot of people have been put under during the pandemic, that's gotta kind of exacerbate those numbers as well, right?
Yeah. And what we know is that well, at least what the research suggests, right, is that loneliness can shorten a person's life by an estimated 15 years, right? And that's a lot. And we also know that social engagement later in life can help reduce that chance of cognitive decline. And even for those with genetic risk for dementia, having frequent or constant social activities can reduce that rate for about 35 to 40% lower.
Okay, so again, with the community lens on this, right? So plan events, right? Find ways to reach people. I know this event that we're all part of today is kind of an example of not only in-person gathering, but also online, the hybrid events. Because I do know that part of it, people risking their health to be out and mingling is difficult. So making sure that we provide opportunities for people, but also so that people can hear at these gatherings, right? We need to make sure that we're spacing small groups apart if at all possible, and trying to keep the background noise down. The other one I want to ask about is, because this is something I'm super interested in, is how does oral health what does that have to do with dementia risk?
Yeah, so oral health is an emerging area of interest, right? We know that there is a correlation between oral health problems and dementia, but what is driving that is still unclear, right? So we don't know if it's poor oral hygiene that's causing dementia, or if dementia is causing people to forget to floss and brush their teeth, right? And so what some of the studies suggest is that for the first part of that is the bacteria in the mouth that causes gum disease is associated with developing Alzheimer's disease and related dementias. And how that happens is that the bacteria from the infection in the mouth can carry to the bloodstream and the brain. And once it's in the brain, then the bacteria will release enzymes that destroy the nerve cells. So that's what one side of it says. And I think the important point is to remember that we need to keep up with oral hygiene and dental care. And so when you're out in the community, right, really emphasizing the importance of oral health when you're talking to older adults or adults from different cultures and communities as well.
Well, as you know, this is oral health is something that we here at Act on Alzheimer's have been very involved in. Last year, at this very summit, we announced our dementia-friendly dental basic training for practices around the state of Minnesota, so that professionals could feel comfortable that they knew how to interact with people who are showing signs of mild cognitive impairment or a form of dementia related illness. So we did that, and Dr. Steve Schumann at the University of Minnesota has also worked with us and Michelle Barclay to put together an advanced training for the clinicians themselves. But that is not only going to help, I'm hoping, help treat people once they have been diagnosed, but also make people in general, the community, more aware that dental professionals are knowledgeable about how to help you if you are having some memory issues, and that it isn't a scary place. And by promoting more frequent visits, that we can really help with that as well.
Yeah, and that aligns quite well with thinking about risk reduction in terms of slowing the progression of it, right, for someone already living with dementia. And so that's all part of the work that we need to do for risk reduction.
Okay, so I know you and I could go on forever because we have. But we're winding it up, but we have a big announcement to make. And so why don't you tell everybody what MDH is doing today?
Yeah, so the Department of Health is partnering with other organizations on that are working on dementia-related work, and we are launching a survey. So the Minnesota Dementia Infrastructure Partner Survey, which is designed to help us understand what exists in the state to support dementia programming and work, so that we can learn to improve it, right? And so we're asking organizations to help us complete the survey. So we're asking organizations that work on dementia-related topics. And the survey, I believe, the survey link should be in the chat, or will be in the chat shortly if it's not already there. And just letting you all know that the survey is now open, and to please help us complete it by November 1st.
So that's why I'm excited about this as a way to wrap up today, because we started out by saying this is a coming together of people from all over the state, right? And we're trying to work together to come up with different community plans. Well, now we are asking you, here's an action step, right, to take this survey so that we can get a feel of truly what is happening out in your community, what formal services are in place, what informal things are happening. So I think, Jess, are you going to put the link in the chat, I think, and then the survey is opening today, and they would like everybody to fill out this survey by November 1st, okay? And get it back so that we, because MDH is going to share this info, right, with us, so that we can all strategize together on how to make Minnesota more dementia friendly as a whole.
Yeah, and we're asking one person from each organization to complete it. So not everybody in the organization who's working on it needs to complete it, but maybe the person who's most familiar with the programming, to give us an idea of what exists, and where the service, or where the need is as well, so that we can all work together to plan a better infrastructure for supporting dementia work.
That's right. I don't know if it's in the chat yet, and Mark just asked, is there an access code we can enter?
There is not an access code, right?
Okay, it is in the chat, great.
And just to add that it is in the chat, and we will send the link out to everyone who has registered for the summit. So you will get that link shortly.
Thank you, all support team here in-house, making all these things happen behind the scenes. I love it. And I love that we are coming together, as I said, from around the state. So as Maiyia said, if one person per organization, please, but if you are from a small community and there isn't anything formal, please feel free to fill it out and tell us, you know, where you are, what you would like to see, and what, you know, and if there isn't anything, help us identify that too. Because we aren't going to get better at any of this until we know what the current state is. So thank you so much, Maiyia.